We have a device that sits by the bedside that we call Luna, and Luna has radar built into her, and the radar can detect things like heart rate, breathing rate, sleep stages, in and out of bed, does someone enter the room, etc. As an example, you might have a congestive heart failure patient, and while over the 3 days in whatever dashboard you're looking at, you can see their weight going up, you might need someone to flag for you that over the last 3 days, their weight went up, and they might be retaining fluids, and you might want to increase the level of diuretic. It's not about the technology itself, it's about what it enables. So most people are focused on like, oh, AI, cool, but it's not about the AI, it's about the care that AI enables. It's about the burden that it eases for the caregiver. It's about the insight that it could provide to the clinician, and then the end result, which is the outcome.
Hello and welcome to BetterTech. I'm Jocelyn Poole, your host, and I'm really excited today to welcome Jamey Edwards, who is the President and Chief Strategy Officer for Cairns. And we're really excited to have a longer talk with you today because healthcare and AI are pretty much the hottest topics out there.
For sure. It's great to be here, Jocelyn.
Am I saying Cairns correctly?
You are. Cairns Health. Yeah,
Okay.
for sure.
Good. So today, that's a pretty big title. Tell us a little bit about what that title means, what you do every day, and what you were doing before this.
Yeah, I don't know that any title in a startup is actually all that big, candidly, because you tend to wear a lot of hats. My background
So
initially,
you're like CEO and janitor.
yeah, exactly, because you do everything, right? It's the nature of the beast. You fill a gap where a gap needs to be filled at the moment it needs to be done. So I think that's a big part of startup life, and it's actually part that I really enjoy. I enjoy the variety of it. But background-wise for me, I'm a serial social impact founder. I actually started off the first 10 years of my career doing investment banking and private equity work, but that was more of a means to an end. While I enjoyed the work, it was a chance for me to learn about how to raise money and take a look at different companies and see what they did well and didn't do well. I always knew since college that I wanted to run businesses, and I fell in love with the concept of entrepreneurship, right? This idea where you could take a thought in your head, make it real, make it matter to people, and have it positively impact their lives. So I got the opportunity to run a family business, which was an ER hospice and anesthesia group back in 2006. And that's kind of where my healthcare journey began, because before that, I spent a lot of time in like internet, new media, and those sectors. But ended up growing that business from 12 million in revenue to 175 million in revenue in an 8 or 9 year period. And I had, I ran the business side. We had a clinical team running the clinical side, and we got to build a great company. And we expanded the services from just ER to hospice medicine, anesthesia medicine, and beyond. While I was there, I co-founded another company that brought language interpreters to the point of care for limited English proficient deaf and hard of hearing patients. That company was called Cloudbreak Health. It's now known as Equity Health. And that was an incredibly gratifying company. We grew it, spent 12 years building the business, 15 years building the business, and grew it to a leader in the space. It was truly a pioneer. We were the first people to bring video medical interpreting to the world. So that was exciting, and we built it out to thousands of hospitals across the country. And then we merged it into a SPAC. And I found myself after that, my transition time with the public company at Startup Health, which is the largest digital health innovation ecosystem in the world. 500 plus companies in the portfolio focused on building moonshot communities, and just got to rejuvenate my spirit, coaching and mentoring other founders across 15 different health moonshots, help architect their Health Transformer University program, and then was approached by Cairns to kind of come off the bench, if you will, and get my hands dirty running a business again. And my business partner, Andrew Ritter, is the CEO. He is an entrepreneur in residence at Coastal Ventures, and Coastal had built a company that had a bunch of really cool technology, but they hadn't commercialized it. And so we were brought in to develop a new product roadmap using that tech and build out Cairns Health, which is now centered on using artificial intelligence and machine learning for the benefit of seniors and polychronic patients. The whole goal is to take very complex care plans, simplify them, and then use a digital health assistant and context in the room to help these patients navigate those plans and break them down to voice, right? We think voice is the ultimate interoperability tool, and we think that voice-driven healthcare is the future.
Wow, there's so much to unpack there, and I have a ton of questions. So,
Hope I didn't go too long, Joycelyn.
oh, well, and the beauty of podcasting is the producers have to worry about that, not me. Uh,
Yeah.
but no, it's good to get a full picture of it. So did you say you took over a family business and grew it from 12 to 175 mil? I just think that's very interesting because it probably gave you a special perspective, both on the medical business and on being a founder. I just want to dig into that a little bit.
Yeah, I've definitely have founded companies from scratch before, but walking into a company that had a culture that needed to change, that needed infrastructure built, it was very much like a founding opportunity. And it was great because I was able to teach the doctors about business, and the doctors were able to teach me about medicine. And I got to see firsthand what the problems were facing the healthcare system. Um, you know, Doctors who are unappreciated, unhappy, and felt like technology that was coming in was intermediating their intermediating their patient relationships,
Right.
and making it harder for them to practice and harder for them to have objective judgment and all those different types of things. So, the physician burnout thing is real. The physician crisis is very real. It's probably one of the biggest issues facing the country right now is that we don't have enough physicians for the demand that we have. And I think what we've seen is an increase in specialization and a decrease in people committing to things like primary care or geriatrics.
Right.
And they're the quarterbacks of the healthcare system, but they certainly don't get paid NFL salaries, if you know what I mean. They tend to be the lowest compensated physicians in the stack. So I think there's a genuine problem there.
Yeah, interesting. Set the stage for us well, let's go back to what you're building, and we'll talk a little bit about what that is, and then I want to get more context from you because I think some of the trends that you're touching upon are very interesting to other founders as well. Um, Not direct competitors, but um, so tell us just sort of like very simply, what are you building?
So we have a device that sits by the bedside that we call Luna, and Luna has radar built into her. And the radar can detect things like heart rate, breathing rate, sleep stages, in and out of bed. Does someone enter the room, etc. We're also starting to look at the audio we have on the device because we have microphones built into it. So if someone falls, can we verify that they fell? If they're walking into a bathroom, can we hear the toilet flush? Doing those
Mhm.
types of things. But more importantly, we're looking for changes in the data that come off the radar and using it to trigger an intervention that a large language model assistant that we've created, that's Luna's persona, can help with to improve the health span of the patient. So think about medication reminders, mental and behavioral health assessments, addressing things like social isolation and loneliness,
Mhm.
and having a set of eyes and ears for the caregiver at the bedside. And it's really about connecting the caregiver, the clinical team, and the subject or the user, the resident member patient, into the same ecosystem so they can collaborate around their care. So the loved one feels like they're not alone. And so, and peace of mind for the caregiver because they now understand that someone else is helping them ease the burden.
Interesting. So I think I want to kind of take that narrative that you're sharing with me and break it down in a couple of different ways because I think for those who may not be familiar with the medical world, some of that sounds very straightforward, but isn't. And so I
Correct.
want to kind of break it down a little bit. So I'm going to start on the tech side, if that's okay. Just because that's my background.
Go for it, Jocelyn.
Is this based on the evolution of lidar? There's just been so much new stuff available to do exactly kind of sensing work that you're doing.
Yeah, we actually use mmWave radar. It's what the company's algorithms have been built on. We have 36 patents, protecting a lot of the work that we've done over the years.
Mhm.
I think we realized, by the way, that the radar itself, is great for doing things that are like relatively close range because
Mhm.
of the millimeter type of radar that we use. So it's
Mhm.
relatively high fidelity for things like heart rate, breathing rate, and detecting things by the bedside. But we realize there's a broader play out there, and we're exploring other types of sensing technologies to pair with our device
Gotcha.
that can give us broader contextual information in the room. So
Okay.
could LiDAR be a thing? Yes. We're looking at things like Wi-Fi sensing as an example. That's a burgeoning space that we think has a lot of applicability in healthcare. And again, looking at things like the audio signal as well. So I think we realize that the end game is going to be an ecosystem of devices, but the first thing is to have this hub that we've created that is actually a very powerful edge computing device that
Mhm.
integrates the intelligent ambient sensing because it's all passive. There's no camera that we're using, so privacy and things like that are not an issue. But we pair that intelligent ambient sensing with the large language model assistant, which is really a lifestyle assistant, to help ease the friction of the user.
Now, when you're saying it's connected back to the caretakers, there's a part of me that sort of I'll give you 2 ends of the spectrum, and you can tell me where you fit in on this. There's a part of me that's like, "Don't I already have that for my dog?" And then the other part is, like, I'm thinking about, like, big hospital centers like Johns Hopkins where people have radios and, like, how do you get into that ecosystem, right? So,
Yep.
those are the kind of bookends I think of when you say this reporting back to the caretakers. Help me understand that a little bit better.
Yeah, so one of the things we've built out for the clinical teams is a clinical portal. And let me tell you right now, the last thing that clinical teams need is another place to go to find patient health information. So our interoperability strategy is playing into that, where we can actually embed our information into their existing workflows. And I think that's an important part of easing use of the system.
Mhm.
But the problem that we have today is that doctors and clinicians are overwhelmed by the amount of information that they see. So using the artificial intelligence algorithms, we can flag things for them that are of note and raise them to the level of importance that they deem. So as an example, you might have a congestive heart failure patient, and while over the 3 days in whatever dashboard you're looking at, you can see their weight going up. You might need someone to flag for you that over the last 3 days, their weight went up and they might be retaining fluids and you might want to increase the level of diuretics, right? So
Mhm.
being able to take the information, translate it into an actual insight, and then have that insight translate into an intervention is really the secret sauce and the magic that happens behind the scenes.
And how, where are you in the maturity of your product launch? Do you have product in the field?
Yeah, so we launched our MVP 2 months ago. We have product in the field. We have collaborations that we've set up with senior living facilities.
Mhm.
So we're working with the farms in Memphis. We are about to launch at UCF down in Florida. And we're very excited about these types of partnerships. We have a partnership that we're working on with Indiana University Health to build
Mhm.
out Alzheimer's use case on the platform. So we've had a lot of traction very early on. People seem to understand the value that we bring in terms of being the glue that holds the experience together, and
Yeah.
the ability of this passive monitoring to really provide very valuable information to the clinical team. And for the caregiver, the opposite side of that spectrum, the peace of mind they get when they wake up in the morning and say, you know, your mom's vitals look great. She slept for 8 hours and she's on her way
Mhm.
to physical therapy. You as a caregiver can breathe a sigh of relief knowing that you're getting some assistance and support in for what many of these caregivers is a second job, right? They have their own families
Right.
to take care of, and taking care of their loved one sometimes is a real burden. And I hate to say it that way because it's a burden of honor, but it's a burden nonetheless. And so being able to give them the support they need at a reasonable price, not having to hire somebody else to watch, and look over your loved one, is a huge value.
So is this device, considered, and you're the expert on this, not me. I'm gonna say words and then you jump in. Which is
I'm
like
going to
there's
follow your lead, Jocelyn.
thank you. That's what I need today. Um, there's like FDA approved, and then there's like therapeutic, and there's different gradations of health devices. Help me understand how you'd like your thing to fit in.
So right now, our goal is not to use our vital sign monitoring or contextual monitoring to replace any type of FDA device, right? To do what we're doing now, we do not need FDA approval. The next stage of the business's development, yes, if we can use our heart rate and breathing rate and they are
Mhm.
FDA approved, that could replace another type of monitor. But really right now, what we're trying to do is flag a change in the data, show that to the clinician, and let them make the decision as to whether they want to order a test or not order a test, et cetera. So I would call it a first line or last mile of sensor notification. But you don't need FDA approval to say this person's not getting out of bed, right? You
Right.
don't need FDA approval for those types of lifestyle or activities of daily living. We would need FDA approval if someone is relying on our heart rate and breathing rate for a diagnostic situation, but we're
Okay.
just using it to flag that there's an issue.
That's a good
By
way
the
to
way, we
explain
are
it.
on the path to FDA approval though. We just don't have it yet.
Gotcha. Okay, that's a good way to explain it. So thinking about the intersection of tech and healthcare, I've been in tech for a long time, and I love technology. But you know what? It's usually not the main thing that makes a company succeed or fail. I'm sorry to
Correct.
say. And so, like, in your opinion, what challenges are going to be the biggest, or have already been, or will be the biggest challenges to adoption?
Yeah. So, Jocelyn, this is a great question. One of the things that I have always said about technology is it's not about the technology itself, it's about what it enables. So, most people are focused on, like, oh, AI, cool. But it's not about the AI, it's about the care that AI enables. It's about the burden that it eases for the caregiver.
Hmm.
It's about the insight that it could provide to the clinician, and then the end result, which is the outcome, right?
Right.
So we're very, very focused on, as we get the product into market and doing, taking anecdotal information, doing studies that show the power and the outcome that can come from this technology innovation. So, let's set the table there first and say it's not about the tech, it's about what the tech enables.
It bums me out. I have to tell you, I'm a tech person at heart, but it is absolutely. I've proven this to myself 100 times throughout my career. It's
Yeah,
absolutely
Jocelyn,
the
how many
case.
times there are a lot of really cool technologies out there that never see the light of day that people would be amazed that people aren't using, but because they didn't provide the value that they were supposed to provide or they were
That's
marketed
where the
poorly.
rubber meets the road, right? And
Right.
so my experience has been it's kind of in the feels for something like this. And what I mean by that is I love your statement about like they have too much data, they have too much information or not enough. These clinicians have to, I mean, some doctors are hiring people just to follow them around and write stuff
Yeah.
down and look stuff up because it is so. I paint a picture, first of all, paint a picture for the audience of because you've done it of like
Yes.
what
20
does
plus
it
years.
look like, when you're really a doctor on or a clinician on rounds?
Look, it's really difficult for these doctors. We were in a situation when the advent of the EMR came out and meaningful use
Which
pushed
is
its adoption.
just in case people don't know, EMR, oh, like
Electronic medical record.
mhm.
Yep. So when the EMR came out and meaningful use pushed its adoption and hospitals spending millions and millions of dollars on these systems, what you ended up with is instead of me looking at you, I'd be like, "Oh, Jocelyn, how's that feeling?" "Uh-huh," and I'd be typing on my keyboard. So you'd hear the clicks in the background, right? And be like, "Okay, let me answer this question." And then it templatized healthcare. So what you saw in a medical record wasn't even accurate. It was a template that a doctor was using
Oh,
to
that's
speed
such a
through
great
their
shout out.
day.
They're forcing it into some sort of drop down. Sorry, I'm
Right.
sorry. I think that's such a great I've never heard that observation before, but you're right. The template kinda shifts the info.
Right. Did they do 10 different differential diagnoses? Probably not, but that's what's in the template. So, it really impacted the way that doctors care. Where before, like if you looked at
Mhm.
a chart is 100% communication based, right? It's what's your history of present illness? Give me your family history. Like, there's a whole interview process that's done here that actually builds rapport and trust between the patient and provider. What doctors were seeing is that now is being compressed and they weren't getting to spend as much time by the bedside. And then they had to spend time doing order entry. And they really saw almost like a commoditization of their art. And I think that hit a lot of doctors really hard. Also, you saw a reimbursement environment that wasn't valuing necessarily the interview and everything else. It was like, how quickly can I get through these patients? Like throughput became a really big deal because hospitals were overwhelmed. Patients were sitting in beds. There was a lot of inefficiency. And so the goal was, how can I turn this patient as quickly as I possibly could? Instead of sometimes, can I get them the best care or should I order this test?
Yeah. Mhm.
Those
I
things
wanna
were all
pause you.
issues.
I think it's so interesting the way you're describing this because 'cause you've got these pillars that are squeezing caretakers, and I think of the RNs as well and, like, the people who are, like, the caretakers.
Yeah.
Because you've got the insurance companies, you've got the tech, right? And it's all kind of squeezing them down, and also a lot of the organizations were inefficient. I think that's such a smart call out because they kinda left themselves open to this kind of optimization that then again has an unintended consequence of squeezing that main caretaker. So I know that's what you're saying, and I'm just repeating it, but I think it's really a valuable thought process and how we came to be where we are today.
Well, Jocelyn, I think if you think about it, right? Healthcare is 4.3 trillion plus of spend in our country and growing, right? It's 20 plus percent of GDP. That's a real problem. If you take a look at our stats versus other nations, like we're ranked 30th in WHO standings for a lot of our performance metrics. So something is clearly amiss and we're spending money in the wrong places. And I think $1 trillion of that spend is inefficiency, administrative costs, all those different types of things. And our goal is to address that $1 trillion problem by one, getting these polychronic patients, which are a huge amount of healthcare spend, getting them to stick to their plan by allowing them to bring it to that, by allowing us to bring the plan to them on their level,
Yeah.
right? By engaging in a simple conversation about what they should be doing, keeping healthcare top of mind. And we think by doing that, we're going to be able to save the system a lot of money, improve the experience for caregivers and the clinical teams, and increase the health span of that user.
Well, let's get into some of the spicier topics, though, because I want you to explain to
Let's
me
go.
a little bit more about. We're talking about impact on patients, right? Where that's where the rubber meets the road. Um, I work with a lot of startups in the healthcare space, and everybody has some claims about how they're improving the lives of patients. Everybody has their own metrics, and it gives me pain sometimes to figure it out. So, what would your advice be? Like, how do you go a step further? How do you measure it?
Look, when you're taking a look there, I think one of the problems that we had when we initially took over the business was where do we apply this tech in a way that is going to have its greatest impact and get the results that you're talking about? Because it's those results that people are going to look at and say, oh, we should do this because it's going to save us 1.5 FTEs, because it's going to improve the care of the patient and make sure this patient can age in place for longer, which means they don't go down that cascade of independent living, assisted living, skilled nursing, hospice, right? And we're prolonging that. It's like, oh, this can save us costs because we now don't have to round on these patients. We're allowing it's going to increase retention because this nurse can now practice at the top of her license and not worry about some of the lower level things. So it's going to increase our ability to retain our greatest assets, which is the employees. So like those types of things are all really important. I think my advice would be like, our issue is we had like, what market we're going to go into, how are we going to prove our use cases out? So we set up co-development partnerships so that we could actually build these data sets. And that's what we're in the midst of doing right now, working with these co-development partners, building the data so that when we actually go to market in full, kind of in the January timeframe, we've assembled data that we can show the results that we want. And it's not just anecdotal stories. It's like, no, here are actual case studies,
Right.
the impact that we've had. And we've done that in collaboration with our clients. And I think that's the important part. It's not saying this is what we're going to do, go to a client, we're going to force this down your throat. It is, what are the problems you're facing as a client and where can we have the most impact
Hmm.
that's going to matter to you?
Hmm. And I like this whole idea of it's observed inputs as well as right stated or force fit into a template. Now we talked about the numbers, but do you have some early experiences or anecdotes you'd like to share with that or that you've heard from your customers and clinicians?
Yeah, the prior iteration of our platform was actually a sleep solution. So we use the technology to do a study with on and build out a cognitive behavioral therapy for insomnia.
Hmm.
And over the course of that study, we found that 70% of people were able to use the platform and experienced a decrease in their ISI, their insomnia sleep index, and that it proved that the little behavioral nudges that we gave them and helping them wind down before sleep and setting morning intentions actually proved to be really important. What we discovered about that solution, though, is a lot of people weren't willing to pay for like a longitudinal sleep solution. And so the life of it was relatively short. People would use it for 3 months, solve the problem, and then move on. And it just wasn't a sustainable business model. But that sleep is still a key part of what we do as a business, is monitoring the sleep of our patients. What we've done is take that 8-hour journey and now expand it to a 24-hour journey. And we're helping people during the day. We're putting them through assessments. We're having conversations with them about the news, their favorite sports teams, all those
Hmm.
different types of things. And it's proven to be incredibly productive. And so what we're doing right now is, satisfaction scores, showing that people are, increasing the length of time that they're aging in place at a current level of care. Those are things that we're in the process of gathering data on right now, and actually the efficiency that we create at the point of care.
Well, I think it's one of the interesting things about your proposal here, and I'm thinking it through as I'm talking to you, is that you're at the intersection of some big concerns around AI as well. Right?
Yep.
And they're gonna have to get dealt with. I'm just curious how you're dealing with, so don't take this as a gotcha. But, you're gathering a lot of data that is highly sensitive, right? You're using AI to insert that information into the process. AI can hallucinate. And then lastly, I like this idea of offering some nudges and, engaging the patient. But, there's been a lot of discussion now of like maybe that's too personal or it's like too confusing to the human mind. I know you've thought about these things. What are your thoughts about that kind of general scary area of the downside of using AI and handling highly sensitive data?
Yeah, well, look, I come from 20 years of HIPAA compliance in the previous companies that I built. So, building on a HIPAA compliant stack is something we've been very focused on doing. We're very concerned about patient privacy, which is why we don't have a camera as part of our solution. If
Mhm.
someone tries to hack our radar signal without our algorithms, there's very little that they can learn from it, right? So, from that perspective, we've really focused on maintaining patient privacy. I think the second piece is that patients expect something different from us than they expect from a Google or Google Home or Alexa.
Mhm.
By that, I mean those systems aren't healthcare platforms. They are marketing platforms, and people are very concerned about what they'll do with the information when they have it. Will there be any breaches there? I say something on my Alexa, and boom, the ads on my browser change, and it's like, how many times have you said, "Is my Alexa like listening to me?" Because the ads I'm getting on Instagram and everything else are then targeted towards me. But for us, we're expected to come in and be proactive. So in many industries, we've traded privacy for convenience
Mhm.
across in banking, in e-commerce, like all over the place. So in healthcare, that's the expectation. People are saying, "Oh, you know what? I'm expecting them to have this information, and we have all the proper guardrails in place to protect it appropriately."
Who
Does
owns
that
the
mean
liability, actually, out of curiosity in a situation like this? I would imagine, like, the clinical whoever owns the clinical setting would hold the liability.
correct?
Okay.
Correct.
And then
And
in a
a lot of times, like, this information that we have is being held in another platform. It might be held in an Epic or a Cerner or something like that. So from that perspective, there's like all of those health systems are doing all of the proper things they need to do to protect the information. Does that mean there aren't breaches? No, there sometimes things happen and there are breaches, but then you do what happens during a breach and you remediate it appropriately and you get people LifeLock or whatever
Mhm.
protection you can have from an identity theft standpoint. And I think it's become a regular part of society today, unfortunately, that those breaches happen. We're doing everything we can to protect that data, though.
I have a totally off side question that wasn't on our list, but I did a medical data startup which was proofed identity at end of life documentation. And so to do that, we had to reach some level of HIPAA. It was not
Yep.
like nothing like what you did because we are like a little startup, right? Does HIPAA work? Do you think it works? I mean, I'm just thinking about this question because in finance, like we started out like with the crash, we put a lot of guardrails in, and some of them I think I'm like, oh yeah, we definitely need that, and then others I'm like, oh my gosh, this has turned into its own checkbox activity that's
Right.
actually not affecting the real world. So just curious, what your thoughts are on that.
Look, I largely think HIPAA does work. Is it perfect? By no means is it perfect. I don't think there's any system out there that's perfect. And clearly, when there's a breach, um, you hear about it because if there's a
Hmm.
breach at United Healthcare, that's millions of records. If there's a breach at, a health system, that's likely millions of records that get out. And so those things happen. But I would tell you right now, if I go to the dark web, I'm sure my credit card is all over the place with my email and
Right?
passwords, different things, right? So it's like I don't know. I think HIPAA is an effort to do the best we can given the environment.
Okay, interesting. Just curious because you're an expert on it.
I think
Um,
that I think the issue is when people use HIPAA as an excuse for interoperability not to happen, right? And I think patient data should belong to the patient. And it shouldn't be used as a tool where, if like, I can't get access to a lot of my records at various health systems and things like that. I don't know where
woof,
they all are.
right?
There's no centralized depot for my info, and that needs to exist, right? And what should happen is there's a centralized depot that I own and manage, and when I go to a hospital, they log in, put in their information, and then they're out, right?
Hmm.
It shouldn't be used as a way to keep an EMR in place or as a walled garden.
I really think that's interesting, and we're kind of nosing over into the world of the future of healthcare. So that's one. I like your perspective that the patient owns their own. I sort of digital twin, their health twin
Yeah,
online. I like that idea. What else do you see evolving? In the Bill Gates once said it's really easy to predict what's going to happen in 2 years or 20 years, but it's the in between time that's really hard to understand what's going to happen.
for sure.
My words, not his, but it's sort of general theme. What are your thoughts about kind of where we're going 5, 10, 20?
Yeah, look, if only I had a crystal ball, right? I think the interesting thing is, and I just published a article on this on LinkedIn literally
Oh,
2
yeah,
days
I
ago.
just read that actually.
Yeah.
People should check that out. It's really good. Sorry, go ahead.
Yeah, so, like, this concept of, like, agentic AI, the revolution we're going through right now versus what happened during the internet. And on, the early days of the internet, it was like, it's going to change everything. We're doing this. And by the way, it did eventually change everything. But just like every other revolution, there's a revolutionary cycle or a hype cycle. You can refer to Gartner for this. And you go through this thing where everyone gets very excited about it. Then you go through the disappointment that, certain things didn't pan out the way that they did. And you weren't able to change one human behavior for one given point of reasoning. And then you go into the trough of disillusionment, and then you realize that it's just integrated into everything that we do. And you receive, you're no longer like amazed by it. You're just like, it's the expectation. And I
Right.
think that's where we are,
That's a
right? So
joke I
for
always
me,
use. We used to say e-commerce or digital this or that. We
right,
don't do
right.
that anymore.
Any business with a .com after it got a better valuation. Right now, who has a .com after their company name?
But plenty
Nobody.
have a .ai, right?
Yes, plenty have a .ai. So we're seeing the exact same cycle play out over and over and over again.
Right
And
on.
so future of healthcare wise, look, I'm hoping that we can empower the patient more to take better control of their care by engaging them by the way that we are with their voice. I think voice is the operating system of the future, not tapping on your phone or typing into a keyboard. If you really think about
Hmm.
the most equitable, easiest way for us to interact with any system is to converse with it. And so I
Mm-hmm.
think there's a big future in these agentic AI, devices and assistants that help people do things. And you're just going to be able to one day be like, oh, book this restaurant reservation for me and do this for me and do this for me. And it's just going to go out and do it. And that's the most natural way for us to engage with technology.
Yeah, interesting. Well, we're slowly pulling into the station to the end of our conversation. I want to do a rapid fire round with you that kind of touches on a little bit more about you and your thoughts on leadership and how you're staying on top of the industry. But before
Okay.
we get there, is there anything I haven't asked you that you wanted to talk about, or something coming up like an event, or how people can get in touch with you?
No, I would tell people to check out our website, Cairns.ai. There we go with the .ai at our names. It's not in our
Hey,
brand, but
if I was
we do
advising
everything
you,
after
I
the
would advise you to do that. This that you you have to live in the real world.
But if anyone has a loved one that they're interested in using the service for, we're going to be launching a direct to consumer avenue and a beta test to get this in the hands of many people
Okay.
as we possibly can. So that's coming up. But otherwise, find me on LinkedIn. Let's engage. I've been publishing a bunch of content around the future of healthcare and agentic AI and things like that. And I always enjoy engaging with people on social media platforms. So either LinkedIn or Instagram.
Great. All right, rapid fire. What
Let's
is
do it.
one quality that you think separates good leaders from great ones?
I would say that one quality is listening. I feel like a lot of times we expect great leaders to be out in front, up on stage. But I think the best leaders actually sit there and spend time with their employees and listen. And I think that's a hard thing to do given time pressures that a lot of these CEOs have or leaders
Hmm.
or people who are running companies. And I think, the opportunity to hear someone and make them feel heard is like a beautiful thing, and you learn more from listening than you do by talking. So I would say listening.
I think we've covered how AI will probably transform healthcare. Outside of healthcare, just as you're like driving along on the road, what's going to get the most impacted?
I think it's so interesting because I now use ChatGPT every day. And I am amazed by its capabilities. That being said, it's not like a sentient AI, right? It truly is an algorithm. It's not artificial general intelligence. We haven't achieved that yet. So I think the future is going to be about like, I think startup life, it's going to revolutionize. So much easier now
Hmm.
to start a company when before you're like, I have to hire this person, this or this, this or this. And when you can go to ChatGPT and be like, what's my marketing plan? If I'm starting it up, what's the best way for me to
Boy,
architect a go-to market, right? Like, and ChatGPT can help you with all of those things. So I'm really looking forward to the value creation that tools like that can bring to startup life.
um, as a do you have like a tech leader from the past or present who you just really admire or look up to?
Yeah, look, I think you have to give respect to certain people who are out there, like Elon Musk for what he's accomplished. He's, given all the stuff that's happened lately, he's not as much as my favorite as he was before. So I really have been focusing like the person who got me into entrepreneurship and laid it on for me was like Steven Jobs, like Steve
Hmm.
Jobs and what he accomplished and this concept that he laid out. And there's a great quote out there, and I'm not going to do it perfectly, but it's basically like everything that you call life was made up by someone just like you, and you have the power to change it. You have the power to build things. And that for me has always stayed with me.
If you had to summarize your leadership philosophy like into just one tagline or motto, what would it be?
Lead with heart. Lead with heart. At the end of the day, building great companies is about building great teams. It's about building great stories that give those teams meaning in their daily lives. And it's about building companies of meaning, right? So from that standpoint, I think heart is what does that. And I would say lead with heart.
All right. Well, that's a great place for us to end today. Thanks for coming on the show, Jamey. It was great to chat with you.
Thank you for having this very important conversation, Jocelyn. I really appreciate the time today.